Anemia in pregnancy is a condition in which the hemoglobin concentration falls below 11 gram per deciliter and the hematocrit falls below 33%. It has been classified into the 4 classes according to the hemoglobin concentration. 10 to 10.9 gram per deciliter hemoglobin occurs in a milder form, 7 to 10 gram per deciliter in the moderate form, less than 7 gram per deciliter in the severe form, and less than 4 gram per deciliter is the hemoglobin concentration in the very severe form. A pregnant woman is said to have anemia if she has less than 11 gram per deciliter of the hemoglobin in the first trimester, less than 10.5 gram per deciliter in the second trimester, and less than 10 gram per deciliter in her third trimester. Anemia is also classified as a nutritional and as the hemoglobinopathies. The nutritional anemia further includes the iron deficiency, folic acid, and the vitamin B12 deficiency anemia. The hemoglobinopathies further include thalassemia and sickle cell anemia. Iron deficiency anemia is the most common type of anemia that occurs in a pregnancy in 90% of the cases. It occurs due to increased iron loss that occurs in menorrhagia, increased sweating, schistosomiasis, and the increased GIT blood loss, for example, in the hemorrhoids. It also occurs in a defective absorption of the iron, for example, in amoebiasis and giardiasis. It also occurs due to tea or the coffee, which are the iron absorption inhibitors. The patient mainly presents with the fatigue, shortness of breath. Besides, the patient may be found to be pale and may have a systolic murmur in the mitral area in the very severe cases. On running the test, the hemoglobin concentration along with transferrin, ferritin, RBC indices including the MCV, MCH, MCHC are decreased. As the iron concentration is decreased, so the iron binding capacity is increased, but the transferrin saturation is decreased. Treating the iron deficiency anemia depends upon the duration of gestation, anemia severity, and the complication that might have occurred during the pregnancy. The blood transfusion is the preferable treatment if the patient presents on greater than 36 weeks or have a very severe anemia. But with the blood transfusion, only the hemoglobin is increased. With the iron therapy, both the hemoglobin and the iron stores are replenished. Oral iron is given to the patient if she presents at less than 28 weeks or she has a mild to moderate anemia. Parenteral iron, on the other hand, is preferred if the patient is presenting at greater than 28 weeks.